Welcome, everyone. Let me have the pleasure of introducing the speakers to begin with. We have two speakers from Health Enable, and they are Erika Layer, Director of Digital Health Technical Delivery Team from Health Enable, and Emika, Senior Digital Health Technical Advisor, also from Health Enable. And then also we have the speakers from 6 countries. We have a mix of speakers from the WHO regions of Sierra and Wipro, the Western Pacific region. And let me introduce Park Rudy. Park Rudy is the head of Health Electronic Systems Surveillance Team from the Center for Data and Technology, Technology and Information, Ministry of Health, Indonesia. And then we have Dr. Chansali, who is the Deputy Director, Department of Planning and Cooperation, Ministry of Health, La PDR. And we have Dr. Muhammad Padli. He's a public health specialist, Health Informatics Center, Planning Division, Ministry of Health, Malaysia. And we have Fatima Sharma, who's the Director of Health Information Management and Research Division from the Ministry of Health, Maldives. And we have Dr. Gloria Nenita Blasco, who's the Director for Knowledge Management Information Technology Service and Director Epidemiology Bureau, Department of Health, Philippines. And we have Dr. Palita Karunapema, who is the Director of Health Information Unit from the Ministry of Health, Sri Lanka. And our speaker from Global Fund, Mr. Mark Landry, is unfortunately not able to join us due to an emergency. So we will have the speakers from the 6 countries as the panelists. And then maybe we can now hand over the floor to the speakers. Emika and Erika, over to you now. And first, we will have about I think 40 minutes. Now that we have one panelist less, I think we have about 40 minutes to share about the Global Digital Health Monitor and have a short demonstration, then followed by the panel discussion. Over to you, Erika and Emika. Thank you.
Thank you very much, the AeHIN colleagues, for having us, for making this opportunity for us to present. So Jai has introduced me. I work at Health Enable. Health Enable is the secretariat of the Global Digital Health Monitor. And this presentation I will try to run through the value proposition, the main features of the GDHM, and how countries can request link, either request link to create their country data or update their country data if partial data has been updated in their country information, or even if it's non-government data that was already populated and then the government now want to update the information. We're going to talk about all of that. And then we'll discuss what are the best practice for completing the data, what's the profile of the kind of people who should look at and complete that information. And then Erika will go over some of the data and the analytics that came out from data that's already populated there. I will also, before I hand over to Erika, go over the questionnaire using a typical country so you can at least see how the forms look and the indicator groupings and how a bit of some interpretation of what those indicators look like. And then also look at how to use the data that's already populated in the GDHM, both the country data and even data at global level or at regional level. So I'll just jump in straight away. The Global Digital Health Monitor is a multi-stakeholder initiative, and it's an interactive digital web resource for assessing the digital enabling environment maturity of countries. It allows countries to benchmark themselves either with other regions or globally. The monitor provides visibility into the status and historical progress that countries have made along components of the digital health enabling environment. And it empowers ministries, funders, policymakers, and industry stakeholders to make decisions that are informed and are based on data. And this decision can allow them decide where to allocate the limited resource for key areas of digital health enabling environment, or even for scaling certain digital solution. And you can also evaluate by using a standardized, evaluate countries by using a standardized evaluation metrics. And he uses the WHO ITU eHealth Strategy Toolkit, which I believe many of you here in the room are already familiar with, are probably using as part of your work, which categorizes digital health enabling environment component into 7 key component areas. And we're going to look at those component areas, but also it motivates countries and help them to track their progress, identify areas of weakness. Some countries use it even as they develop their digital health strategies, and better prioritize which areas to put the limited resource that they have. As I had indicated earlier, the GDHM is categorized along the WHO ITU eHealth strategy component area, the 7 component areas: leadership and governance, strategy and investment, legislation, policy and compliance, workforce, architecture, standard and interoperability, and then the services and application. But also, it has 23 core indicators, but also just to highlight that while these indicators are grouped according to this area, there is now addition of emerging technologies, gender and equity and inclusion and human rights, and alignment to UHC, and also alignment to the WHO's digital health strategy. And these are changes that happened over the last 1 year, and we held stakeholder consultation and engagement, which many of you in this room probably were actively involved or were contacted during that period in 2022 when the indicators were reviewed. After we conducted an assessment, conducted regional workshops in Asia, Africa, and the Arab region. We also had a global workshop where a few of us here were also part of. We came up with a set of 23 indicators and made changes to align with both the WHO's new strategy, ensure alignment to UHC, and also made sure that there was inclusion of emerging technologies, including IoT, blockchain, and AI, mostly readiness, country readiness for use of these emerging technologies. So the dashboards, this basically shows what we will be going through the actual platform, but this dashboard shows where what the views were designed to look like sometime in 2022, and this has we've actually gone ahead to build out this platform earlier this year, which was launched sometime in May at the World Health Assembly. And a few of us here that I see in the room were also part were at the launch in May in Geneva. There's also the components of subnational, because that conversation keeps coming up, where countries like Nigeria, India, and I think Indonesia, and a few others like the United States are not able to fully complete national data because they are very segmented, they are federated, and they have this increasing request for subnational data. But just to highlight that this feature has not yet been built out, but is a conversation that is ongoing. And I know a few countries in the Asia region also would like to have this feature. This is a disclaimer that while this feature is not there in the demo that you are going to see in the live platform, the conversation is still ongoing to bring this feature on soonest. So now we will look at how to get involved. To complete the information for your specific country or country that you're interested in is to send an email to request a country-specific link to info@digitalhealthmonitor.org. And that email will then be responded with a series of questions to clarify your profile, for being interested in receiving this link. And of course, the main interest that the Secretariat will be trying to understand is if you are the representative for the digital health, the digital health representative for the country that you are requesting the link, or if you are a digital health stakeholder who is knowledgeable in the space for the country that you are requesting the link. Either of these qualifies you to receive the link and complete the form. And when you do receive the link, you're going to have a form like this, and the form is then what you will complete. But again, understand that the best practice for completing this form is not for an individual to complete the form, because as you're going to see when we look at the indicators, is that this form is best completed by diverse group. We recommend a minimum of 3 who come from not the same organization, but it come from diverse organization and background, because you're going to see that these questions sometimes require knowledge from heavily technology stakeholders and then heavily clinical and public health stakeholders. So it's always good to balance this out when you try to complete this information. So the link that you're going to receive will be something along the lines of this. It's going to give you a link like this, and then you use the link to move on with completing the information. So to get involved, if you click on the digital health monitor, at this point, let me pause and just go to this link. So if you go to the if I had gone to, let me start from there actually, digitalhealthmonitor.org, it will take you to the website where you can get all of the information that you need to learn more about the digital health, global digital health monitor, how the stakeholders that are involved, how to participate. Some of this information that I have here, you can also see the how-to guide, publications around it, and other things. But then to go to the actual monitor, you click on that link that I just clicked on, and it will land you here. And the link that takes you here is monitor.digitalhealthmonitor.org. It will bring you here. So this site just shows you how to use the data that is on the monitor, on the Global Digital Health Monitor. But before I come back to this site, let me go over, assuming that we had applied for a link for a country, Andorra, and we received the link, and the country link, you click on the country link and it leads you here. So you see that you can complete the form using, following the information provided here. But I just want to highlight that, yes, you may complete the information as a group, but sometimes you find out that you need to, you work as a group, and you have to enter the information of one person in the group, and this is something you have to agree amongst yourself, who would be that person that will represent your group as you're completing the information. So you provide the role and the email and the name. At the same time, sometimes some data, if you remember, I had indicated earlier that there are some, you can enter the data as either authoritative government stakeholder or non-authoritative government stakeholder, and you're going to see data later when we look at the data. For now, if you are entering the form as an authoritative government stakeholder, then you have to check this, and in that case, the government approval information is now mandatory for you to enter. But if that's not the case, you can also enter government country contact information here. In addition, you are required to enter a summary for the country. Typically what countries do is, because each question, as we will see shortly, will require justification. So going over all the 23 different justifications, you can just aggregate them together and use the information from those justifications to create a summary information, like half a paragraph or a paragraph that you can then use to represent as the public-facing country information. if they are publicly available resources like the digital health strategy or policies or any resource assessments that are already publicly available, the links can be provided here. You have option to provide up to 5 resource links here. You can see now that here is the questions, and we're not going to go into these questions in detail, just for you to see the questions that if you select whether you have prioritized digital health at national level. It could be either you've not prioritized, you've prioritized, there's an SOW, there's none, and you meet regularly, not meeting any of this that meets the criteria. And if this is not applicable, you can also select not applicable. But remember, the justification or the rationale for any option you select is mandatory. So this field has to be completed. This is also another question. We follow the same suit, whether or not digital transformation is prioritized. See the question on readiness for emerging technology, one of the new questions that was introduced after the redesign last year and the rebuild. And then diversity, equity, and inclusion is one of those new questions as well. Provide justification why you think this actually supposed to help countries to make decisions on how to actually make decisions on how to act or decide to act based on their responses, so that next year, because the platform has a year-on-year feature, you can see that the questions are grouped according to the category, the 7 key component areas of the digital health enabling environment. And these questions are pretty straightforward, but again, sometimes also understand that it takes about 45 minutes to 1 hour. As the number of people involved in the completion process grows, the time it takes to complete it also increases, because then there are many back and forth before you arrive. That it's often easy to reach a consensus on what the particular responses are. So this are the component. Okay, so specifically this question 17. For question 17, you simply go to this link and then determine where that particular country is ranked on this on this link, and then come back to complete this information. The information is there for over 90% of the countries in the world. It's a Portland Institute technology. It's actually the replacement of the Network Readiness Index that was used in version 1. So that's it for the set of questions. I will now quickly go back to the web platform after you've completed the information. For this, let's assume that we are picking one country, say CAR. I click on CAR and it just zooms in. I need to click a second time for it to take me, and then you see where CAR is ranked. You can also select the country by clicking on this and selecting the name of the country. Let's say if I select Zambia, for instance, it will take me as well to that place, and what you are seeing here is the overall ranking for Zambia. And if I click here, it takes me to the country information, showing the details of the information, including that summary I talked to you about. This is publicly available. Information on the context and the health information are all automatically pulled from the World Bank data bank. Then you can go and then see information for the different categories, and see that the information showing here is the 2023 data. There is a version 1 data, which is any data that has been entered before before the redesign this year. And then 2024 data will also show here as well, and you can decide how you want to see it. And since this is Zambia, let's say we want to compare Zambia to the Africa region. You see that first the spider graph is redrawn, but also you can also benchmark and compare to the region. So you can see the data for the different categories and benchmark as you see. But you can also view the regional data. Let's see the Southeast Asia, and you can see the information of the countries, the version 1 and the country information overall. and then you can see how the information compares. You can also compare version 1 as well. Some countries do not have version 1 information, so you won't see. The next tab is the countries that are currently, whose information are currently here, just so you know. While there are many different countries, there are effectively about 72 countries that actually completed the information fully. Most of the other countries you will see under methodology here. Let me just quickly go there, that some information from those countries were updated with these 7 indicators that you are seeing here using these data sources that you can see here. And those information are what is there, and which is the reason why when you go to the world map, for instance, you will see that countries like Canada, United States, even though they do not have complete information, they have data because they have partial data. And if I follow this through, you see that there is no workforce data for the United States, there is no standards and all that, because this information were not there in the methodology, were not part of the methodology data that got uploaded. You can also see the list of indicators. It's also possible to export the data because sometimes, for instance, now that we do not have the subnational data, some countries, say India, would want to download the data and use it for at the subnational level or for other purposes, maybe some subnational level. It's easy to get these indicators from here and use. So what else do I have? I think I would stop here now and then wait for any question or turn over to my colleague Erica, and then she can take it, and then we'll respond to any questions you have. So I hand over to you, Erica.
Great. Thank you very much, Emeka. So, hi, everyone. My name is, as Jay said, I'm Erica Lair. I'm the Director of Digital Health Technical Delivery at Health Enabled. And what I want to do quickly is to share a summary of results from the data that we have received from the Global Digital Health Monitor this year to date. So this includes 62 countries globally that had submitted data by the 15th of May. And I will show a global overview and then dig a little bit deeper into the CIRO, the CIRO and the WIPRO regions, which are most applicable to this group. So again, amongst the 62 countries that completed data, you can see a graph here. Basically what we did is we took the average scores. As Emeka mentioned, there are 7 different categories based on the WHO ITU framework for e-health and digital health. We took the average amongst each of those 7 categories, and then we further took the average to get the overall average for a country. And this slide shows a global overview. So what you can see here is that a majority of countries, or most countries, 45%, are in phase 3. And as Emeka described, for each of the 23 indicators within the GDHM, there are 5 phases, 1 being the least mature and 5 being the most mature. So most countries are really right in the middle at a phase 3. There are 16 countries at phase 2, 14 at phase 15 at phase 4, and 3 countries that are already at a stage 5 of maturity. If we break this down further by region, you can see an interesting trend, which is that the European region in general is at a higher level of maturity at phase 4, but all other regions globally average out to a phase 3. And then if we further break this down, looking at each of these components that Emeka described, leadership and governance, strategy and investment, and so on, we can see that the category with the highest level of maturity is leadership and governance. The lowest level of maturity globally is workforce, which is at phase 2, and all of the other phases are at phase 3, which is consistent with the global average. Now, if we go into a bit more detail and look at the Southeast Asia region first, what we can see is that this generally follows the global trends. So within the Zero region of the countries that completed the survey, leadership and governance is at a phase 4, at the most mature. Most of the categories are at phase 3. And here, difference from the global average showed that workforce was the lowest maturity globally at phase 2, but in Zero is ahead of that at phase 3. And instead, Zero is less mature in the standards and interoperability category. You can see here the average broken down by countries within the Zero region. So we have Bangladesh, Indonesia, and Thailand coming in at phase 4, Myanmar, Nepal, and Sri Lanka at phase 3, and the Maldives at phase 2. Now, if we turn our attention to the Wipro region, you can also see some interesting things here. Wipro is at the global average with leadership and governance at phase 4. They are also ahead of the global average for infrastructure, also at phase 4. However, consistent with the global average, other categories, strategy and investment, legislation, policy and compliance, services and applications are all at phase 3, whereas workforce is at the global average of phase 2. And then as we break down the Wipro region by country, you can see 4 countries that are averaging in at phase 4, so ahead of the global average, including Laos, Malaysia, Philippines, and Vietnam. We have New Zealand at phase 3 and Cambodia at phase 2. So because of time and because we want to spend most of the time really discussing with countries how they use this, there's a number of slides that I will not go into that really break down each of the 7 categories into each of the subcomponents. And we can share this with everyone after the webinar. But I just quickly want to summarize a few recommendations from this preliminary analysis of the GDHM. So as I mentioned, globally, digital health maturity is at phase 3, and this includes the Wipro and Zero regions. So that indicates that some investment is being made across most countries and progress is being made. We have seen globally that there is greater investment needed in certain countries to help them reach their full maturity. As a region, this includes the EMRO region and the Afro region. However, as you can also see, there are a few countries within Wipro and Zero that can use additional targeted investment in order to bring them up to the global and, in fact, regional averages. We also identified that there's very high demand for cross-country and regional learning, specifically between countries that are at a higher level of digital health maturity and those are at lower level maturities. So as you can see, when I shared the slides by region, by Zero and Wipro, there's a good mix of countries that are in phase 4 and also countries in phase 2. And so I think probably representatives from all of those countries are on this call today. And this could be a good opportunity to identify some cross-country support and regional learning to support higher and lower income countries to learn, lower maturity countries, to learn from each other. We also saw that leadership and governance across the board is relatively mature, including both Zero and Wipro. So investments in this area should be sustained, but not necessarily the focus of future and new investments. For the category of strategy and investment, there is a need for greater investment of public funding and a supportive environment for private sector engagement. So I did not go into these slides, but if we pull apart specific questions, we'll see that specifically public national funding for digital health and then private sector engagement falls far below some of the other categories. And both Zero and Wipro are at a phase 3 for strategy and investment, indicating that some progress has been made, but there's a lot of room for improvement. In terms of legislation, policy, and compliance, what we see from the data generally is that we we do have relatively good maturity in data protection and cybersecurity. However, there's less maturity in regulating and certifying connected health devices and AI, as well as policies for cross-border data sharing, and those should be prioritized in order to support countries to increase their maturity in this area. For workforce, as I mentioned, this is the lowest maturity across most countries. The global average is only a phase 2. So we have seen that CIRO is slightly more advanced at phase 3. WIPRO is at the global average of phase 2. So what this tells us is that greater investment as well as standardization is needed in trainings, pre-service training for health workers, in-service training, professionalizing digital health career paths within the public sector, and especially gender representation within the digital health workforce, as well as governance. So this is an area that we have identified that is scoring low across the board, especially including in WIPRO as well as CIRO. So for standards and interoperability, most countries do have data standards. However, what we're seeing is those are not necessarily being operationalized. So many countries have policies and standards in place, but when it comes to scaling those and rolling them out, that is really not being scaled in a systematic way. Similarly, for infrastructure, most countries have plans for supporting digital health infrastructure, but now we need to work towards implementing them. And I think that is one of the key trends that we have seen is a lot of investment has been done to help countries put in place strategies, plans, guidelines. These do exist, but what we're not seeing is how that translates into implementation and sustainable scaling of these systems. So finally, in services and applications, there is a need to invest in civil registration and vital statistics, patients' feedback, and readiness for emerging technologies and AI. So that's kind of a broad overview of global trends, as well as how CIRO and WIPRO fit into that. We will be developing a State of Digital Health report at the end of 2023. That will include the data I presented today, as well as analysis of new data coming in before September 30th. So what I would like to do is encourage anyone on this call whose country is not fully represented, who doesn't have all of the elements filled in. You can look at the map that Emeka shared within the monitor. If your country isn't represented, get in touch and we can work with you and support you. And there's an excellent network on this call who have done this extensively to make sure that even more countries in the Asia region are able to be represented here and within the State of Digital Health report that's coming up in 2020, at the end of 2023. So that is all that I have. I think at this point, we can stop here and maybe go on to a few questions before we go into the moderated dialogue.
Thank you, Emeka and Erica. It was very, very helpful to condense a whole lot of work into a short overview. Very helpful. I think we have two questions. I see one from Manisha from India, and then also Plube from Hong Kong. So maybe we can take those two questions before we move on to the panel from the countries.
For Dr. Manisha, we have 3 questions. The first one is, any initiatives taken to ask each country to provide data?
Sure. So I can take that, and I think maybe Jay, you can also jump in because AeHIN was a part of this this process. I will say that what we did this year was to really use networks. So we engaged with AeHIN for the CIRO and WIPRO regions. We engaged with RICENSA for Latin America, with the European Connected Health Alliance for European countries. And largely relied on personal contacts and introductions within ministries of health. One thing that I did not mention in my presentation, nor did Emeka, is that we have been in discussions with the World Health Organization for the past several years, really, and they have now formally agreed to adopt the Global Digital Health Monitor. So this is a really big step in terms of progress for the GDHM. What it means is that WHO will be housing the GDHM within their systems, and they will be the custodians of this moving forward. So we anticipate that this is going to significantly streamline the way that countries are providing data, because it will be mandated by WHO, it will be supported by WHO globally, and that will be a way to get lots of more countries to feed into this, and hopefully more systemically. I know that Jay and AeHIN have a lot of ideas and examples from countries where broad stakeholders have been brought together in consultative workshops, which have been extremely effective in initiating dialogue. And I know you'll hear about that today. That is the kind of process that we want, so that this is really owned by stakeholders throughout the government, so that we can really maximize the value of the tool and the way that countries provide data.
Yes, thank you, Director Erica. There are two follow-up questions to that. So, any plans to train or educate country contact personals? And perspectives of experts and country contact may vary. So, any mechanism to homogenize the information?
Sure, I can take the last one, which is also part of the panel questions. So yeah, maybe Erika, maybe the second one, maybe you can take, and then the last one I can take that.
Sure. And I think that the answer to the second question relates to the first. As this process is more rolled out, as it's institutionalized, as it's completed every year, and supported by the WHO, that will provide, I think, more comprehensive training to country contacts. We've also added a how-to guide within the website that goes through step-by-step how to complete this, but we want to make sure that there's a group of stakeholders in every country that complete this year on year and fully understand the system. And that will happen as WHO further embraces this tool.
Thank you, Erika. Manisha, I can answer a part of it, because like primarily AeHIN works with, as you are aware, that we work with the Ministries of Health. So we went with the contacts in the Ministries of Health. So who was involved in the process were oriented with the questionnaire, like we had discussions, interviews with them. That was how there was a first phase of orienting them with the new questions and then how to answer them. There was also a guide of how to go about the survey, and then the survey actually began. And then actually your third question, this is actually part of the panel discussion that is following. Certainly, this is very important question, because it's not only the MOH that has the answer to all the 23 indicators. There are multiple other stakeholders involved. So what we tried to put together, at least for the 2023 survey, was to put together a committee, a panel of experts from within the country to homogenize. So I think we will come to that as part of the panel discussion. I hope that answers your question in the interim till we come to the panel discussion. We have two other questions, or three other questions. So I see one from Klube, then Aminul from Bangladesh, and then also Dr. Kiran Park from Wipro. Can we take those two also and then move to the panel?
So the question from Sir Klube says, any mechanism, indicator, or initiative to measure and track the ROI and social impact of digital health?
Yeah, so regarding the return on investment, that's not the focus of the GDHM, I would say, but it seems like something that would be an interesting and great thing to measure, the return on investment. So this measures the maturity and helps for a quick and easy determination of where the country ranks, and then decide on what action to take. So I'm sure there are other tools that can do that now for that particular question.
Yes, thank you, Sir Emika. We have another question. This is from Dr. Aminul Islam. The country mentioned in phase 4, how about status of data quality assessment in these countries and any statistical report?
Well, the information by the countries are just viewed from the perspective of the justification. But something that we did not even go into is the fact that from the GDHM, you can decide, you can look at the year-on-year progression of the different overall and the different indicator categories, including the capacity building and the standards and interoperability or governance. And each of these you can look at each country and you will see some countries progress, some do not. But for those that have mentioned that they are in category 4, we just take them based on the justification that they've provided. And if the justification they provided at the time of entering the data did not quite justify, we'll go back and forth with them until we arrive at the appropriate data that they should enter. For instance, if they enter pay 4 and there is no justification, then the secretariat will go back and ask, wait, you have 4 here, why did you say you are 4? And the justification could be a sentence or 2 sentences or a resource that is publicly available. And that's how we move on. But we do not have a right to say, no, you are not 4, because we believe they are expert and should report. It's actually self-reported information.
Yes, thank you, Sir Emika. Our next question is from Dr. Kidong Park from WHO WIPRO. The question is, do you have some country cases showing progress moving forward in digital health maturity over several years with multiple maturity assessment?
I was only going to highlight, I guess, maybe share my screen to show how you could see the year-on-year information for a particular country. Say this is Gabon, and you can see that Gabon did not make any progress. But if we,
Emika,
go on, please.
Sorry to intervene. Is it possible to pick up an example from our region, either CRO or WIPRO?
Oh, sorry. Okay. Yeah, let me do that.
Maybe Lapidia, Sri Lanka, or Philippines, or any one of them. Malaysia, for example.
Sure.
Those who participated in the previous survey and then the current one.
Let's go there. So Lao. So this is Laos data, and if we go here, you can see that Lao has made progress overall. But we can also try to see leadership and governance. They've not made progress, but they are at 4. Strategy and investment, they've made progress. Possibly they've just developed their strategy or have costed it. Workforce has made progress from 1 to 2, but the global average that they are benchmarking has actually reduced or gone down. So that's positive. Global average has not changed. The standard and interoperability has increased from version 1 to version 2. Infrastructure has done the same progress. In fact, service and application, there's been 2 jumps from phase 1 all the way to phase 3. So in terms of whether these changes happen for multiple years, remember that the version 1 did not have this year-on-year feature. So all the data that has been captured for all the countries we class as version 1, whether they were captured in 2018, 2019, or 2020, they are version 1, and then 2023. And then going forward, we will now have different year data. I hope that answers the question. I'll stop sharing.
Thanks, Emika. I think you answered what I wanted to say. Just that, like, we had the previous versions all clubbed into one, and then Dr. Park, like, going forward, I think it should be possible to have that kind of a comparison, because so far we just had 2 iterations, I would say, like, or the previous ones clubbed into one. But going forward, I think prospectively you should be able to have that kind of a comparison. Thank you. I hope that answers your question. And then maybe I think it's time to go into the panel discussion, or do we have any other question that relates to the speakers right now? Okay. Just wanted to show you that AeHIN has had a long association with the Health Enable team, especially since we used to call it the Global Digital Health Indicator. And then it was very, we were very happy to partner with Health Enable to work with the countries in the region. I think it was 12 countries that we worked together as part of the survey from both the CRO and the region. And we will have a panel discussion today, and then you will see some of the familiar faces who are already there, as you could see in the picture of the launch event on May 25th, but the questions are different. And then you're also welcome to post any questions in the chat, and then we will take at the end of the 2 questions that I'm planning to post to the panelists. Thank you. And we have countries here who already have a digital health strategy or a digital health blueprint, and then those that who are actually revising or revamping the eHealth steering committee, and then like we have a good mix here. So I think we will have a very interesting discussion here. And the 2 questions that I have in mind for the panelists are, how are you utilizing, now that you have participated in the survey? Some of them are most of you in the previous iteration, as Monica mentioned, and then all of you actually have done the second version recently in 2023. Going forward, how do you think, or how you are already been utilizing the GDHM? How is it relevant in your country context? And how are you using it if you've already started using it? That's question 1. And then the second one is, this also relates to Manisha's question. It's about updating GDHM. I know the time it takes and the effort it takes. And then for a country, especially a large country, this can, and then also has a federal structure, this can also further add to the challenges. But going forward, how do you plan updating this year over year? Because that's also important. Do you think that you can have a panel that consists of various stakeholders in your country, like apart from the MOH, there could be other ministries, there could be academy, there could be national professional societies or NGOs, and then even representation from the medical associations or patient groups. We could have such a diverse, inclusive panel so that the data that comes out from the country is quite balanced. So that is the second question that I have. I can probably, or anyone wants to take these questions first, you have 5 minutes, please. Try to answer these 2 questions within 5 minutes so that we can also take additional questions from the participants. Thank you. Yes, Dr. Chansey, please go ahead.
Okay, I'd like to respond some of the questions that you have talked. Possible utilization of GDHMI in our country context. Actually, I think that we are now implementing the, for example, now we have a health system reform. So the GDHM is really right tuned to us, also in line with the Ministry of Health to improve the integration of health information system in Laos. So is it really directly linked to the really useful tool that we can, for the country that ongoing development of national digital strategy, because we would know, can assess that which part of the digital strategy we like to strengthening, like presentation, the 2 presentation is very useful. And also how we are using this, how we starting. I think in order to using this GDHM, I think before we use, we need to fully understand the content of the tool and familiar with all the questions that if we have time, we can involve the stakeholders who are working in this area and also the expert to agree on where we are now, in terms of the digital system. Because the GDSM is including all the components of digital health, like in AeHIN, we talk about the gap. So everything already there. We can use this tool. So we could use to assess the readiness of each component to support implementation of digital in our country. So for the second question, talking about update the GDSMI, I don't know. It depends on different country, annually or semi-annually. I don't know, but I think some I think annually it's some component of the digital component might not be changed, maybe the same, but some component will be changed. But another question talking about whether we can bring our stakeholder. I think this is necessary that we need to pin out the tool and maybe share with other stakeholder, and then we can sit together and make an also assessment where the country is in terms of digital health, where we are now, which part we need to improve on this. So I'd like to contribute that. Over to you, Jai.
Thank you, Dr. Chansey. I just wanted to add, I think you also used the previous survey results as part of the dissemination workshop for the digital health strategy. I noticed that. So there was actually a use of what happened during the survey. That was one thing that I noted during the dissemination workshop in Laos. And then also the second one is like, I think you also probably agree with the trend regarding the findings on the workforce. So that's the pillar that also needs attention. Maybe that also relates to your country. Maybe if you have any reflections, that's okay, or we can move on to the next panelist.
Yes, directly, because we are now in our digital strategy. We are now focused on how we can strengthening the workforce in Laos for more long-term sustainability of the system. But aside from that, we're also looking for other like a standard and other things need to be go along with. But I really appreciate that the tool is helping us to do the job to start our implementing. But also I like to mention that how we can turn, even though we already have the strategy in place, but we need to translate into practice now. We are now implementing the strategy already 7 months. Some of the activity already progressing. Over to you.
Thank you, Dr. Chansey. Who would like to take the set of questions next? Is it Dr. May?
Thank you, Jay. So to answer the first question, for us, the GDHM is really relevant. And I speak of it not just as a tool actually to monitor our progress year on year, but I think it reveals a number of components that are actually particularly vulnerable to such shocks as, for instance, a pandemic. And I think for us, very important to increase both our attention in those particular areas that are more susceptible to those kinds of shocks. So I would think that, for instance, in terms of the systems and applications, really operationalizing is one area that we also want to focus on. So in general, it's also relevant because, as I mentioned, we want to document our progress year on year. But I think for us, particularly allowing us to benchmark ourselves with other countries and countries with similar contexts and similar general context, for instance, governance structure, and even in terms of the overall e-health environment. So that's one. We've started using the GDHM already, in fact. So we've included indicators from the GDHM as part of the indicators that we will be monitoring in our forthcoming national e-health strategy for 2023 to 2028. And then now when it comes to updating the GDHM, our overall objective is actually to incorporate it in what will become core work of the e-health governance structure that we will be establishing and which we're targeting for this August. So within that particular governance structure, we have 4 main sub-working groups, and we will be using those sub-working groups to actually update our GDHM moving forward. So that is one. So what we also want to share with everyone is that we are particularly focused on producing high impact outputs through these groups, and we anticipate or are targeting rather that these outputs would contribute to specific indicators being monitored in the GDHM. And then finally, we've already involved our stakeholders in the GDHM updating. So our most recent updating for this year involved our stakeholders. We included this as a specific activity, and we held one of our strategy development workshops. So that is one. But apart from utilizing that more informal way of consulting, we will be incorporating this within the governance structure of our e-health steering committee to provide inputs to the GDHM but most specifically, the overall effort at orchestrating all of those inputs from the different sub-working groups and even our steering committee will be lodged under our sub-working group that is focused on capacity building. And then to complement those efforts, we also plan to generate more evidence on e-health performance through strategic collaborations and even interagency coordination.
Thank you, Dr. May. It was very helpful of how we have already started using. And then also the second question, you have already done that. So very helpful. And then maybe we can have Pak Rudy now from Indonesia.
Thank you, Jay. Good afternoon, everyone. Good morning also for another region. Yeah, thank you. I'm from Indonesia. I'm from the Ministry of Health of Indonesia. Right now, we appreciate that the initiative to develop GDHM as a digital transformation mapping effort in accordance with WHO ITU standards. Right now, or currently, our Ministry of Health is conducting a digital maturity index assessment, which is a part of GDHM. And this is in line with all our effort to the digital health transformation era. In the future, maybe we will use the GDHM as an interactive tool that helps our country to prioritize and monitor digital health transformation, especially at using the WHO or ITU e-health strategy toolkit. We use it as for many years as a foundational of our framework, to especially for the digital transformation in Indonesia. Also, GDHM is relevant in the context of Indonesia because it fits our needs to monitor and evaluate digital transformation. As you know, the Ministry of Health formed a DTO. We have a Digital Transformation Office to strengthen our office, my office is the Center for Data and Information Technology, and accelerating the digital health programs and initiatives. DTO created a blueprint for digital health transformation strategy until 2024, which is focuses on integration and development of health data, system and health application, also as well as the development of health. So GDHM can be useful for the tools to monitoring and evaluation digital transformation in our country. About the update, we plan to update this data at the same time as updating annual national data for compiling Indonesia health profile. So every year we have tasked to make the Indonesia health profile. Also, we must update the digital maturity index. So this is, we plan to update this data for the all region in Indonesia. As well as being used by Ministry of Health, we will also increase the use of GDHM for all health and technology stakeholders, private stakeholder, development partners, as well as regions or provinces to measure the digital process and maturity, advocate for resources, identify areas of good performance that will encourage performance improvement in other regions. Maybe that, back to you, Jay. Thank you.
Thank you, Pak Rudy. So do you think that means that the second part of the question, you want to say anything on that going further? How do you plan to update?
Yeah, we want to update with other people, with another stakeholder, all stakeholder, also with the government from the regional. We mention it as a provincial government, and we do it for we arrange or make the Indonesia health profile annually. So this is the time we want to update this GDHM. I think that, Jay.
Thank you, Dr. B. We will have now Dr. Bradley from Malaysia sharing his views.
Okay. Thank you, Jai. So
Currently,
basically,
over to you.
all right. So basically in Malaysia, firstly, I would like to say thank you for these efforts like making this GDHM tool. Basically in Malaysia, what we do this tool, we use it as a self reflections, kind of like to monitor the progress of our digital health. We do realize we do it by consensus, meaning like we have a discussions between the stakeholder, the champions of the digital health, and we come up with a consensus what best reflects our current status of the digital health within the Malaysia. And from there that we do realize, although we have something in place in terms of the digital health, but this thing is still lack if we want to benchmark it to other country with a higher maturity digital health maturity index. But the one that makes us worry about the digital health is the non-homogeneity in terms of the reporting, because we know it is self-reported, that each country, the way we reported it, there might be overestimation, there might be underestimations. If we just take it from the, let's say, from what there have been reported, if we just take it from the public documentation, so they might be underestimated in terms of the digital maturity. It might, if it is reported by the country, each country, the way they interpreted the indicator might be different. So there might be chances of over-reported, overestimated the index. So hence, the way we take it, this DHM, we take it as a self-reflection tool so that we can see where we are and how we're going to benchmark it. And then we do welcome the efforts from the Health Enable. They take it to WHO, and we are really grateful that WHO taken a step to adopt this DHM. When after this, if WHO mandate this digital health monitor, and then when we have the mandate, then it become sort of like compulsory for all the member states to report this indicator, then this, we think that this digital health monitor can become, other than a self-reflection, it can become a benchmarking tool so that we can compare between the country, because there is a because the way of reporting is now is homogeneous. That's what we think. So in terms of the reporting, yes, I do agree that we can report it annually, but in terms of whether when we report annually, whether it is relevant or not, because I think in the we can't really see the progress within 1 year. Certain of the infrastructure developments and progress in digital health, it might goes into like several years, like 2 or 3 years. Yes, we can do report it annually, but if we really want to see progress, whether it progress or whether it is being stored for certain time, we need to see it for 2 or 3 years. But the good things about the GDHM, for example, the workforce, we do realize that we can see the homogeneous reporting in terms of the workforce. I think over the world, we realize that the health personals and the health worker, they focus on the health job. So basically, they're treating patients, giving the services and all. While the digital health, a lot of the country, they outsource it. So while we can see the progress in a lot of area of digital health, that's why we can see a lack of the maturity in terms of the workforce. That's what we see from this indicator. So looking forward, the progress and how we're going to adapt this GDHM further. Over to you.
Thank you, Fadli. Do you also think it would be helpful to have a multi-stakeholder approach to update this data?
Yes, because when we it's different, we do realize, we compare it. Firstly, we start the exercise with like several persons answer this indicator separately. Then we can see like we got like different kinds of evaluations, because the way we interpret it is different. Then we do like different exercise where we try to get a consensus. Then we can see like, oh, like this person's like interpret this indicator differently, and then this person is like taking it differently, and then we come with a consensus. Yeah, I think when we involve different stakeholders, then we can get like different view of this GDHM for the country itself.
Thank you, Fadli. I think we'll have Dr. Palitha Karnapema from the Ministry of Health, Sri Lanka.
Hi, Jai. Sorry that good evening to all of you, and sorry that my video is not working, but that's fine. Now Sri Lanka, we initiated this health information policy in 2017, and along with that we started with the strategic framework. Now in last year, actually this year, we have completed the development of digital health architecture blueprint and along with the roadmap. So basically we are progressing in that direction. Now this tool actually is reminder that once we are starting to measure something, it's a measurement tool. So we will be improving on certain areas. So in that context, it is very important to have this kind of a tool which capture different dimensions of the digital health. Because we are also using WHO ITU framework to digital transformation in our health sector. One thing is we have used this tool actually in a smaller group within our health information unit, which is the focal point for health in the ministry. So now in the future, actually we are planning to utilize this tool with a wider stakeholder engagement, which is quite important. Other one which I want to highlight is, now once you have the tool and in different areas you have the different scores, and then it is really important to link, for example, from one level when you are going move into next level, we need to have certain set of actions to reach that. Probably in what we are planning to do is we try to identify those things within our annual actions plan and strategic plans, and link those incremental increases with this specific action. Probably even at global level, Jai, what you can think about is similarly, like in there are other tools like for WHO International Health Regulation, Joint External Evaluation, there are tools available which member countries are reporting annually, and probably those tools are also linked with certain number of activities. So probably you can think about this similar fashion to this digital health monitor. It's not only a tool for monitoring, but you can link with the prioritized actions. And then about the probably about the now. Investment is a very important component, especially global level investment. This tool might be a very good, useful tool for other donors, even within the country, and the external donors. So those are the things which I can say. So in a nutshell, it's an important tool, and it is also important to engage the stakeholders and go into the details of the indicators and discuss with them. It's not just about a score, but it's a process. Thank you.
Thank you, Dr. Palitha. It was very, very helpful. And then we will have the Shama from Ministry of Health, Maldives, as our last panelist. Shama, I know that you have been working with GDHM in some way, but I do not have the specifics. And then also your country is in a very important I think the threshold of developing the digital blueprint. So how do you think DHM is relevant to your country context, and how you have been already using it? Thank you.
Thank you, Jay, and good evening, everyone. So as Jay had mentioned, I'm Shama. I'm currently looking after the Health Information Management and Research Division. And as Jay mentioned, let me just quickly go through our journey in how we have utilized GDHM since our exposure to GDHM back in April this year, and also since we got exposed to it further during the May 25th May launching event of GDHM. So once we came back very recently, in fact, during this month, we actually had a bilateral meeting with one of our neighboring countries where we were exploring some areas of support. And one key area that they were trying to explore is digital health. So I was tasked with, compiling our situation analysis of our National Health Information Management System, and we were asked to do a SWOT, so the strength, weakness, opportunities, and threat table. So as you may know, most of the time, these kind of tables are very text-based. It can be pretty heavy. So I was a little bit concerned because my table was quite, text-based, and when you are presenting it for policy makers who are making decisions, it's a little bit difficult for them to really grasp what we are trying to tell in terms of what support we need. So then there was only like 5 minutes remaining for me when I sort of remembered about the GDHM. And I remember seeing their website where they had this really visual way, as you have seen previously in Emeka's presentation, where you see all those bars and you can visually see it, where your maturity level is. So I quickly searched online, and the first thing that came up was the link to their website. And then you see that gray little box that says visit the monitor. And when I visited this, I can then go to the country where I just searched my country. I had to write 3 letters, and it filtered Maldives for me. So within a span of 5 minutes, I was able to search my country's GDHM indicators, take a screenshot, put it in my slides, and sent it to the person who was hosting it. And then I rushed to the meeting within 5 minutes. So on this note, I really would like to say thank you to the team for making a very user-friendly website, because it was the reason why within these 5 minutes I was able to put this into a slide and go to my meeting. So I didn't actually get a time to really look into Maldives GDHM indicators as was visualized in the monitor. But when I was presenting in the meeting and was really highlighting in our weaknesses, mentioning that we have a lot of systems, but they're not talking to each other. There's lack of interoperability, lack of standards, and also in terms of infrastructure, we were lagging behind. And we were mentioning these kind of things. And then I moved to the next slide where the GDHM screenshot was there. And then, I really liked how it seamlessly showed what I was trying to say in my SWOT analysis. It just visually showed that the areas where Maldives was really lagging behind was standards and interoperability, and we also lag behind in legislations and policies. So these are the things that I highlighted in my weakness part. So giving me an opportunity to really, build on what I had mentioned in my SWOT analysis really was good for me. So it actually showed how relevant the GDHM was for Maldives as well. And then I built it on because the country that we were having this conversation with is one of the bigger, advanced countries in our region. And many of Maldivians, through our health insurance scheme, they get services within this country through our health insurance mechanism. So they can really access, specialized care free of cost on cashless basis. But what happens when they go to these countries? We don't have any mechanism to tap into what had happened to them because we are not sharing data with them. So if you have gone through GDHM, you will see that it has cross-border data sharing indicated under the legislation 1. You are scored for that as well. So again, building on that, I did mention that we have to think about this as well. We have to protect our patient security while we think about a mechanism where we can have a cross-border data sharing policy or MOU signed between these 2 countries, because it's going to be a big help for us, especially because in terms of how we are costing our health, this is a free service that we are providing, but government is bearing the cost. So it allows us to be more accountable to the services, and also the patient security, and also the beauty of continuity of care when you are crossing borders and getting service. So I mentioned about that, and it reflects with what is there in the GDHM as well. Another occasion that we recently used GDHM is when we are actually working with the WHO CRO to establish or develop our first digital health architecture blueprint. So a team was here, a WHO mission team, including the regional advisor for health information system. Dr. Amani was also here in Maldives last week. And they also wanted to, have a look at where we are. And then I presented the same, same few slides about the SWOT analysis and then the GDHM. And one of the consultant with the team, the first thing they said was that, going now that we are really moving on with the digital health architecture blueprint, it would be very interesting to see how we are going to progress next year when we repeat the GDHM. And yes, that's the thing for us because we are at a very low maturity level. So if we really measure with what we are doing right now in Maldives with the government's priority of digitalization, I feel that after we, redo that next year, we're going to see a lot of progress. And the last and the final recent one that we used at GDHM was when we had a stakeholder information session during the WHO mission team's visit to Maldives. In fact, in last Thursday, we brought up a lot of stakeholders from different agencies, including the private sector as well. And I asked a question to the team. If I give you a scale of 1 to 5, and I ask you to rate Maldives or score Maldives in terms of our digital health maturity, what score will you assign? And the score varied among the participants from 2 to 2.5 to 3. And then when I showed the GDHM score, it actually reflected to 2. So it really was a good conversation starter during the meeting, and it also helped me to really conceptualize what I'm trying to get support from them, like working on the standards, the lowest ones that we have, and it was really good. So going forward, these are the few ways that we are using GDHM from the ministry point of view. It helps us to really conceptualize our current baseline where we are standing. It helps us to negotiate with other, bigger countries. Like during that meeting, I actually told the more developed countries in terms of their digital health maturity that we believe that Maldives is a toddler, but if a country like them foster us, become our foster parent and provide the necessary support and build us, we will definitely grow into a beautiful adult in terms of our digital health maturity, because we want to move from 2 to 5 in the future, inshallah. So building these kind of negotiations, trying to support which areas that they can provide support, directing them to areas that we really need support is something good. So just to conclude, we do initially plan to monitor our or update the GDHM maybe on a yearly basis, but I agree with our colleague from Malaysia that when we reach a certain point, a saturation point, maybe we may not need to monitor it that frequently. We may consider it to monitor it a little bit to put a bit more gap between the two days, maybe. I mean, like maybe every 2 years or 5 years, but we don't know. But as of now, we intend to monitor every on a yearly basis, and that's because we really want to build our hopes as well, and build our success story as well. And I feel like GDHM can help us to do that because we are doing a lot of work in this area as well. So I do agree that there is a need to bring on a lot of stakeholders when we really update the GDHM. So as part of the global digital health, as part of the digital health blueprint work we are doing, we are going to be having a bit more strengthening of our governance, including establishment of a steering committee and a technical working group. So this committee would consist of many other stakeholders apart from ministry side as well, including the private sector and donor agencies as well. So going forward, maybe next year when we repeat this, we will definitely get support from them and also get it endorsed by our steering committee or technical working group. So that's pretty much a summary of what we have been doing with GDHM now. So thank you, the Health Enable team and AeHIN for exposing us to the GDHM and allowing for us to really utilize a good tool for going forward. Thank you.
Thank you, Shama. That was very, very comprehensive, and then very happy. I'm sure that Health Enable team is also very, very happy to see that it's already in action. I think we are on top of the time. We have 1 minute left, and then also please stay back for a group photograph. I think we had a very vibrant participation. I think we should not leave without taking a group picture. Thank you. Thank you for joining us.
Very much.
We could not
Thank
have
you,
the rural
everyone.
development partner perspective, but then I think we can take that up later. Thank you very much. I know some of you, it is very late time, but really thanks to you for making time and joining us. Thank you. Thank you, Erika, Nemika, and all the panelists. Thank you. Good night and good afternoon.
Thank you. Good night. Thank you. Bye bye, Chai. Bye bye.
Bye bye.
Bye bye.